discover the latest news and advances in the field of health and medicine. Subscribe to our channel now to stay up to date with the latest medical news, from innovative treatments to promising research. Be the first to know everything that's happening in the world of health and begin your journey to a healthier, more informed life. New risk prediction model for cancer-related venous thromboembolism. Venous thromboembolism, VTE, is a common complication in cancer patients and can be potentially fatal. It is important to identify patients with cancer who are at increased risk of VTE so that preventive measures can be taken. Some features that increase the risk of VTE in cancer patients include: type of cancer. Some types of cancer, such as pancreatic, lung, and stomach cancer, have a higher risk of VTE than others. Cancer stage. Patients with advanced cancer are at higher risk of VTE than those with early-stage cancer. Cancer treatment. Chemotherapy and hormone therapy may increase the risk of VTE in cancer patients. Individual risk factors. Patients with a previous history of VTE, advanced age, obesity, and other risk factors. Cardiovascular diseases have a higher risk of VTE. To predict the risk of VTE in cancer patients, there are several risk scores available, such as the Corona score and the CONCO score. These scores take into account patient characteristics such as cancer type, stage, platelet count, hemoglobin, and other individual risk factors, and calculate a VTE risk score. Patients with the highest risk score are considered at high risk and may benefit from preventive measures, such as prophylactic anticoagulants. It is important to emphasize that these risk scores are only a guidance tool and the final decision on the need for anticoagulant prophylaxis must be individualized for each patient and taken in conjunction with the treating physician. Researchers validate OncoTEF score to predict cancer-associated thrombosis in outpatients. Based on the results of their recent analysis, the authors argue for the usefulness of the model in routine and clinical trials for the selection of patients at high risk of venous thromboembolism who may benefit from primary prophylaxis. The OncoTEF score provides good stratification of the risk of venous thromboembolism in this context and, given its ease of use, may represent progress in the study of cancer-associated thrombosis and a rationale for choosing the OncoTEF score. For risk assessment, said the study authors, led by Dr. Chiara Sella, Ph.D., of the European Institute of Oncology, Italy. The study was published online in February 2022 in the journal JAMA Network Open. Venous thromboembolism remains a common complication among cancer patients, but assessment of the risk of associated thrombosis to cancer remains an evolving topic, the researchers explained. Current international guidelines recommend primary prophylaxis for patients at intermediate to high risk of venous thromboembolism, indicated by a Corona score greater than or equal to 2. The OncoTEF score consists of 4 variables: a Corona score greater than 2, metastatic disease, vascular compression, or lymphatic, and a previous venous thromboembolic event, with 1 point assigned to each and a total score of 2 or more. Defined as high risk of venous thromboembolism. The OncoTEF 2 validation study was performed at 3 centers in Italy, Germany, and the UK with a prospective cohort of 425 outpatients, 57% women, mean age 61 years, with solid tumors, who were receiving active treatment. The most represented tumors were breast, gastroesophageal adenocarcinoma, colon, lung, rectum, and pancreatic, and chemotherapy was the most common treatment. The OncoTEF score was calculated for each patient at baseline before starting any cancer treatment, and then, patients were monitored for at least 8 months, with an overall follow-up period of 24 months, to detect any thromboembolic event. No patient was using anticoagulants. When a clinical suspicion of venous thromboembolism arose, the patients were immediately submitted to an objective evaluation with Imaging exam to confirm or rule out the event. Venous thromboembolism events were diagnosed by a team of experienced radiologists. Most patients had a score of 0, 27%, or 1, 55%, while 15% had a score of 2, and 2.4% had a score equal to 3. Only one patient, 0.2%, had a score equal to 4. During the study period, the cumulative incidence of venous thromboembolism was 12.7%, 54 events. At 6 months, the cumulative incidence of venous thromboembolism was 2.6% in patients with an ONCTEF score of 0. Versus 9.1% for those with a score of 1, 32.3% for a score of 2, and 19.3% for a score greater than 2. The area under the time proportional curve at 3, 6, and 12 months was 70.1%, 72.9%, and 72.2%, respectively. The researchers noted that among the individual variables in the ONCTEF risk prediction model, metastatic disease and macroscopic vascular or lymphatic compression were highly associated with venous thromboembolism, hazard ratio, RR, of 4.22 and 3.25. Respectively. Patients with a Corona score 2 appeared to have a higher risk of venous thromboembolism, although the difference was not statistically significant, RR 1.81, P equals 0.14. History of venous thromboembolism did not appear to be independently associated with to the risk of venous thromboembolism, RR 0.84, P equals 0.76. Ready for routine use? Invited to comment on the research, Dr. Alok Khurana, oncologist at the Cleveland Clinic, USA, creator of the Khurana score, noted that the literature on predicting venous thromboembolism in cancer patients is growing with the publication of 2 recent risk assessment models, ONCTEF, which adds more clinical variables to the existing Khurana score, and ONCOTHROMB, which uses genetic variables in addition to clinical risk factors. These models add to a number of existing risk scores, said Dr. Alok, including the Vienna Cancer and Thrombosis score, the PROTECT score, the CONCO score, and, more recently, the COMPASS-CAT model. The current validation study focused on whether the ONCTEF tool could successfully predict the risk of venous thromboembolism. The study is well done and the results show a substantial improvement in positive predictive value, which is important for identifying of the highest-risk patients, said Dr. Alok to Medscape. The main limitations of the study were imbalances between the derivation and validation cohorts, as the authors point out, and the need to external validation, noted Dr. Alok, who did not participate in the research. The commentator found it surprising that a history of venous thromboembolism was not a significant risk factor, as previously has been shown to be associated with a new risk of venous thromboembolism. It is also not clear how ONCTROM and ONCTEF compare, he said. But overall, Dr. Alok agreed that the ONCTEF score can be used in routine clinical management to identify patients with high risk. Dr. Chiara Sella reported receiving honoraria from Bristol Myers Squibb and Leo Pharma and a research grant from Ipsen, Institutional. A complete list of the co-authors' conflict of interest statements is available in the original article. The Dr. Alok Khurana received consulting fees from Janssen, Bayer, Pfizer, Sanofi, BMS, Anthos, and Medscape/WebMD. I hope this video was helpful to you and clarified some of your doubts. If you liked the content, don't forget to leave your like and comment below. Also, if you haven't subscribed to our channel yet, don't waste time and do it right now and turn on notifications. That way, you won't miss any of our upcoming videos. Where are we going? Share even more information and interesting tips for you. Thanks for watching, until next time.